Hello, Mr. Manor. My name is Cecile Morris, and I'll be doing your neurological examination today. At any point during this examination, if you have any questions, please feel free to stop me. Okay, so we're going to begin by, I'm going to ask you a couple of questions, okay? So the first thing I'm going to ask you is, can you state your name? And can you tell me what day it is? What year it is?
2008.
And who's the president of the United States? Okay, so I'm going to give you three things, and then I'm going to ask you to recall them later on for me. Okay, so the first one thing is banana, a monkey, and yellow. So can you tell me your oldest child date of birth? Okay, can you tell me what does this mean to you? The grass is not always green on the other side.
Seeing the way they look.
Okay, good. Can you recall those three things for me?
Yellow banana.
So based on his response to my questions and the way he answered the question, and he was able to reason through everything I gave him, I would say that he's alert and oriented, and he's where he needs to be intellectually. Okay. All right. So next, Mr. Manor, I want to go ahead and start your cranial nerve assessment.
Okay.
So the first thing I'm going to do is start with your cranial nerve number 1, which is your olfactory. And that's just assessing your sense of smell. Okay, so I'm going to ask you to just sniff for me. Hold on to your nostril and do it on the other side. And then I'm going to ask you to close your eyes. And then I'm going to give you something to smell. And I want you to tell me what it is. Hold on to one side of your nostril. Okay, sediment, that's very good. Okay, so the next cranial nerve that we're gonna be looking at is the optic nerve, which is your visual. Okay, and that is cranial number 2. Okay, so the first thing I'm gonna do is I'm gonna actually look at this eye chart on the wall, and I'm gonna ask you to read tell me the line that you can read, see and read it back to me.
3, 4, 7, 6.
So the next thing I'm going to do is I'm going to check your peripheral vision. We're still doing the optic nerve.
Okay.
And I'm going to do this by using my fingers. And when you see my fingers, you let me know it now. Okay? And this is, I'm going to be doing this in as and it's going to be done by conversation. Okay? So your peripheral vision is good. Okay, so the third cranial nerve is called ocular motor, and I'm going to be checking. No, I'm still on 2. Sorry. So I'm going to be using my fundoscope to just look inside your eye. Okay.
All right.
So let me get it ready here. So I'm looking inside your eye. So I'm going to be looking to find a red reflex. Okay. So I'm going to be looking, and once I find the red reflex, do the same on the other side.
Okay.
So I'm going to find the red reflex. And I'm going to come in. So I'm looked at his cranial number 2, the optic disc. And after finding the red reflex and moving in to look into the back of his eyes, I didn't see any abnormal findings, but rather the blood vessel in the back of his eyes looked normal um, when I looked using my fundoscope. Okay.
Okay.
So the third cranial nerve that we're going to look at, Mr. Manner, is called the oculomotor. And so I'm also going to be using my light to just look um, at your eyes, and I'm going to shine the light in it and just look at see how your pupils react.
Okay.
Okay.
All right.
Okay, so pupils equal round and reactive to light. So next, I'm still looking at your eyes because the cranial nerve number 4 and 6 also deals with the oculomotor of your eyes. These cranial nerve I'm going to use to check for accommodations. And I'm also going to be checking your 6 cardinal visual field. Okay. So what I'm going to do is to shine my light into your right eye and look to see if we constrict, and then look at your left eye. Okay. Shine it in your left eye. Look at your right eye. Into the left eye, and is constricting. Looking into the left eye, looking at the right, and it is constricted. Okay. Now I'm looking in the right eye, looking at the left, and it is constricting. Looking at the right eye again, and then looking, and it's constricted. So next, I'm going to be checking for what we call accommodation. Okay. So I'm going to have you look at my finger, okay, and then look back there at the wall, anywhere on the wall, and then look back at my finger, okay. So when I asked Mr. Manner to look at my finger, his eyes constricted, and then when I asked him to look at the wall, it dilated to make accommodation for seeing far away. And then once you look back at my finger, they constrict. Okay. So now I'm going to check your 6 cardinal field, and just to see the muscle and the strength of your eyes. Okay. So I want you to look at my finger, okay? And I only want you to move your eyes. So I'm going to move my finger laterally. I'm going to move it up and down. I'm going to bring it back to the center. I'm going to move it over, up, and I'm going to move it down, back to the center. Good. So your eyes followed my fingers. So that tell me that the your ocular motor in your eyes is very good. Okay. Now I'm going to check. I'm still checking the ocular motor of your eyes. So I'm going to ask you to look at my finger. Okay. Okay. And as I move my finger in, I'm just checking to see what your eyes. Very good. So once I asked Mr. Manor to look at my finger, and I started moving it closer to his face, his eyes moved closer towards the inner part of his face. Okay, so that was cranial nerve 3, 4, and 6. So cranial nerve number 5 is the trigeminal nerve, and that's dealing with the motor portion of your face, and also dealing with the sensory portion of your face. So what I'm going to do is I'm going to ask you, I'm going to feel on your jawline here, and I'm going to ask you to open your mouth for me. Okay, and open again, and close. Okay. So I'm going to ask you to have your eyes remain closed, and I'm going to touch your face, and then I want you to tell me what it is that you feel. Okay?
Sharp, 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 sharp.
Okay. So cranial nerve number 5, checking for sensory and checking for motor function of his face. He was able to open and close his mouth, the strength of his jaw, and he was also able to identify soft versus sharp. So now we're on to cranial nerve number 7, which is the facial nerve. So what I want you to do for me, Mr. Manor, is I want you to raise your eyebrows. I want you to frown. I want you to smile. And I want you to puff your cheeks out. So he was able to do all of the above without any difficulties. So cranial number nerve 7 is intact. So we're on to cranial nerve number 8, which is the acoustic, okay, which is the hearing. Okay. Okay, so what I'm going to do is I'm going to check your hearing. I'm going to look inside your ear, and then I'm also going to I'm going to do what we call a Weber test using my turning fork. Okay, I'm also going to check your hearing, bone conduction, and your ear conduction. Okay. Okay, so I'm gonna place the tuning fork once I hit it on the top of your head laterally, and you're gonna tell me if you hear the sound in both ears or just in one. Okay. Very good. So he was able to hear the sound in both ears. Now I'm going to do what we call a Ryan's test. Okay, so the same thing. I'm going to start over here on your left side. Okay,
Okay.
and I'm going to place the tuning fork behind your ear. Tell me when
Right.
you stop hearing the sound.
Stop.
Okay, sorry. Let's do this again.
Okay.
So you're going to tell me when you stop hearing the sound.
Okay.
Okay.
Stop. Stop.
Going to do it on your right.
Okay. Stop.
So he was able to hear um, the sound when I placed the tuning fork for the Weber test on his head laterally. He was able to hear in both ears. Then when I did the bone conduction and the ear conduction, he heard the tuning fork in on the bone when I placed it behind the ear, but also longer when I placed it in front of the ear. So the hearing was greater in the ear conduction, which is what it's supposed to be, which is normal. Okay, so now we're on to cranial nerve 9, which is the glossopharyngeal nerves, and that has to do with Mr. Manor, your um, checking your uvula
Okay.
and also checking your soft and hard palate and just looking inside your mouth.
Okay.
So I'm gonna have you open your mouth and I'm gonna use my lights. So I'm going to check inside your mouth. If you go ahead and open your mouth for me.
Okay.
And as soon as I get my lights straight, all right. So we are okay. So so here we go. Um, we are going to look inside your mouth. All right. Okay. Now we're in business, I think. Yes. Open up your mouth. Say ah. So his uvula is midline. His tonsils intact, no redness back there. And also, say ah again for me. So I'm looking at his hard and soft palate, and they're intact, no redness, and so no swelling back there on his tonsils. Um, and so that cranial nerve is intact. So next, Mr. Manor, we're gonna move on to what we call the vagus nerve,
Okay.
which is the swallowing. That's the one you use to swallow. So I'm gonna have you swallow. And that was good. So usually the cranial nerve number 9 and 10, usually assess those together when we're doing the cranial nerve test. Okay, and number, that was 11. So 10 was the, we missed number 9, which is the accessory muscle. So we're gonna go to number 9, and it's the, if you shrug your shoulder up for me. Okay, very good. Push down. And then 10, we talk about the glossopharyngeal, which I looked inside your mouth, and then 11 is the vagus nerve, which is the swallowing,
Okay.
and you did that without any problem.
Okay.
And then 12 is the hypoglycal um, nerve,
Okay.
and that's where I'm checking your tongue.
Okay.
So I want you to put your tongue out for me, okay? And I want you to pull your tongue up, and I want you to move your tongue from side to side. I'm gonna try to move it. And so um, he did not have any problems moving his tongue around, the strength of his tongue when I try to manipulate it from side to side. He was able to push back on it and move it up and down. So that this portion completes the cranial nerve portion. Okay. So next we're going to move on to the cerebellum, which is where we test your gait and have you walk and see if you can follow some instructions and then demonstrate for me.
Okay.
So, Mr. Manor, I'm going to have you stand up. So, what I'm going to have you do is I'm going to have you walk across the room, and I'm just going to watch your gait. Okay, good. So, when he walked across the room, his hands sway back and forth with his leg as he was moving, which is normal posture for a gait. Now I want you to walk on your heels, and then come back this way and walk on your toes. Okay, good. And then next thing I want you to do is heel toe. Coordination and balance. Good. So next I'm going to check your what we call Romberg's test.
Mhm.
And I want you come closer to me. I want you to put your arms out like this, and I want you to close your eyes for me. I'm just looking, make sure that you're not swaying. Lift it up a little bit higher for me. Make sure that you're not swaying and that you're not moving. And so that's good. So next, I'm going to do the same thing. I'm gonna have you close your eyes, and this is the pronation test. And put your arms out for me, all the way out. Okay. And I'm gonna push down, and his arms come all the way back up, which is a normal reflex when with the pronation test. Okay. So, Mr. Manor, the next thing I'm going to do is I'm going to check your upper extremity strength.
Okay.
Okay. So I'm gonna have you put your arm up like this, and I'm going to try to pull down on it, and I want you to resist me. Okay. I'm going to try to push up, and I want you to resist me. Okay, so I want to relax your arm for me. So I'm just going to do a little bit of range of motion. This is passive range of motion. Just relax your arm for me. I'm going to bring it up. Okay. I'm going to bring it over, up, and down. Okay. I'm going to do this other side. Bring it up, down. The manner, I want you to go ahead and bring your arms up over your head for me. And I want you to bring them back here, like this. Stretch out, stretch like that. Bring it up. Okay, just good. Okay, very good. I'm going to have you lock your fingers like this for me, and I'm going to try to move them apart, and you should not let me move them. Okay. All right, very good. So make a fist for me. And I'm going to try to bring your arm down. Okay, I'm going to try to bring it up. Don't let me. Very good. So upper body strength, it's pretty good. Okay.
Okay.
Now hold your arm out this way for me. So I'm going to try to push up. Resist me. Okay. And then I'm going to try to push down. I'm going to try to push here. All right. Very good. Okay. So good on upper body strength, passive motion, and also active, right? Passive and active motion was intact. So next, Mr. Manner, I'm going to do your lower extremities. I'm going to have you bring the chair back up here towards me. So I'm going to, no, don't just have them dangling like that. I'm going to check your knees, okay, or your legs. So I'm going to bend down here a little bit so I can get down. You can't really see what I'm doing with his legs. So I'm going to push back on so what I'm doing is pushing, on his leg. I'm pushing and I'm going to try to pull and have him resist me. Okay. So I'm pushing you and you have to resist me. There you go. And then I'm pushing and I'm going to try to pull out. Don't let me pull. Resist. Okay, good. So the next thing I'm going to do with is check the strength in your hip. So I'm going to have you lay back on the couch right here. And then I'm going to bring your knees up here. Both your knees. So I'm going to try to push down and don't let me. And then I'm going to try to push up and you shouldn't let me try to push you, okay?
Mm-hmm.
So next I'm going to bring your hip over your knee, your over here, over, and you shouldn't let me push. Okay, good. All right, so we're going to do it on the other side, over, good. Okay, so hip, abduction and adduction was within norm. Okay.
Okay.
So next, Mr. Manner, I'm going to do your reflex test. So I'm going to have you sit back up for me. Okay. I'm going to have you sit on this chair. And the first thing I'm going to do is I'm going to use this hammer and I'm going to check your reflexes. Okay.
Okay.
So I'm going to start in here what I call the brachial reflex. So I'm going to place just relax your arm just like that. So I'm going to place my thumb here
Mm-hmm.
and I'm just going to hit it. Okay. And right above the reflex. I'm going to do it on the other side. Okay. Relax your elbow for me. Okay. And I did the bicep reflex test and he's reactive. Okay, so next we're going to do the tricep. So I'm going to hold your arm up, bend your arm like this, just like that. Okay. And find it here, this way. Not really reflexive on that side. So we're going to try this one here. Turn it this way. on the other side. Okay, so now we're going to do the patella, which is the knee. Okay,
Okay.
all right, so I'm going to now it's hard to see the test in here, but I'm checking his reflex on his knee, his patella, and yes, that's a common test. So his leg did swing out when I hit it on the left. So I'm gonna do the right. Okay, there you go. So he was reactive with his reflex test on the patella. And that would conclude the neurological examination. Thank you, Mr. Manner.
Thank you.